is now generic. It costs $10 a month. 70–80% of the patients we can put on Plavix safely, wrap the doctor in a Teflon suit, because we did the genetic testing and we knew that we could switch this patient over safely based off the genetic results. Lower healthcare dollars, everybody's happy. So what's happening now is patients are being put on Effient and Brilinta after getting a stent. They go home and they're paying $150 a month for the drugs. Okay, and that's because what their doctor told them to do, and they almost died, right? So wouldn't it be nice if my doctor said, "Hey, I did the best thing for you because I never met you before. You came into the ER. You know, we got you on the cath table in under an hour, got the stent deployed, and we used Brilinta or Effient because that was the safest thing since we didn't know you. Well, here, I'm going to stick this toothpick in your mouth. You know, we're going to get the results back in a week, and 7 or 8 out of 10 patients we can put back onto Plavix at a $10 copay per month." So now you have, in my bag of tricks, if you're factor 2 or factor 5 positive, you need to go on Coumadin. Based off of the Coumadin results, okay, which can vary at a factor of 10-fold if I didn't make that clear to you, you can start, your initial dose can be as low as 0.5 all the way up to 5. So there's a 10-fold variance in the amount that you receive, which is huge. Okay, so if you're factor 2 or factor 5 positive, you need to go on Coumadin, and bam, we have that for you right then and there. So we're going to get you to a stable INR faster, we're going to keep you in range longer, and we're going to reduce your rehospitalization rate. Okay, so we got that. You know anyone that does AV fistulas?
Oh, yeah.
What happens when you get an AV fistula? You get put on.
Yeah, it's variable.
Oh, they don't do Coumadin all. I thought.
Some get low dose Coumadin, like 1 milligram, 2.5 milligrams.
Okay. So the AV fistula patients get it. Your total knee, total hip patients get it. So and then also. If you have a cardiologist that says I use Xarelto or Pradaxa all the time, well, if you have poor liver function, right, you need to be on Coumadin and not the Xarelto or Pradaxa.
Problem with Coumadin, though, almost every other drug interacts with it and changes its metabolism. So how does, that's a tough factor. If they keep changing other medications.
Well, you now know that this is this is going through the 2C9 pathway, so you're going to want to try to avoid other drugs, then, right? Going down that pathway to affect the efficacy of the drug. The reason why I had this up here is 2D6 and ApoE. It says data was insufficient. Some of our competitors are still using antiquated technology that they can't get enough data off the swab, and this is from our older technology. So 99.7% of the reports will come back with sufficient data to satisfy everything. Statins, okay, so ApoE. If you're in E4, which is 16% of the population, we've got a CERC article in there that says that simvastatin, which is generic as well, is the best medication for you. And here are your different pathways of the major statin drugs, so the doctors can look at that. That's it for the presentations. The paperwork itself, you can sign the physician up. You just have to register the account, which Dr. Zaha has done, and some other people here. Once you've registered the account, it goes to AI Biotech, and as long as that account is producing, that account is yours. Okay. Then there's a requisition form that is brand new. The new requisition form.
I think I passed that out earlier today.
Sorry, just put this up. So there's a requisition form that you're going to want to put the physician's name and address on, and just have them sign that once. You can make a photocopy of it. Yeah, can I see that right here? So what you want to do is, this is Dr. Brown, ABC primary physician. Just have Dr. Brown sign right here and make a bunch of photocopies of it. Okay, so the doctor, you don't have to track, the MA won't have to track the doctor down continuously. They'll just sign right there. So if Dr. 2 comes out and says, hey, genetically test this patient, they can just grab this from the stack next to the kids, and then they just have to fill out the patient information, name and birth date, whether it's Medicare, private insurance, or self-pay. Have the patient sign here. And if you talk to the doctor in advance and the doctor says, hey, I want the Persona gene done on every single one of my patients, you can go ahead and check that. And then if they, the ICD-9s are right here listed. 58.69 is long-term use of chronic medications. And there's actually a back to this that you don't have to use, but on the back of it, there's a whole host of other ICD-9s. There's a genetic testing other that you can check, long-term use of anticoagulants, antiplatelets, steroids, pain, palpitations. I mean, you're pretty much shooting fish in a barrel with all the, vague ICD-9s that are cover the test. So this gets sent in, 30-second swab, FedEx it out to the AI Biotech, and the results go to the website. It takes roughly 5 to 7 business days, because if I get swabbed today, FedEx comes and picks it up tonight, gets in our office the next day. Someone pulls the report out, the FedEx makes sure all the paperwork's correct, sends it down to the lab, and then, like I said, we have a very sophisticated lab and a very methodical process that walks everything through the lab. So it takes 3 to 5 days to get through the lab, and then what happens is the results get posted on a secure website, and then what they can do is fax over the result sheets to the physician's office when they're posted, so they don't have to continue to look to see if they're posted. Questions, comments, complaints?
Just from a sales standpoint, if you go to a doctor's office and they're like, okay, Dr. Tu said there was more than biotech is not the only personalized genetics testing company, right?
Right. And
What would you say about why should we go with you?
well, and Dr. Saha asked me that earlier tonight, and it's a common question, okay? There are a million of these genetic companies trying to pop up and do things right now, okay? Because everyone sees this as a big growth opportunity, okay? AI Biotech has been doing this for 20 years. It's the largest lab of its kind. This lab is 32,000 square feet. It's massive. The office space is in a completely separate building, okay? We do all the government testing. We do what's called next generation sequencing, which is a far more thorough look of the genetic makeup, which is more accurate than the other ones. We're the ones that's going to be publishing the data on 15,000 patients using next generation sequencing that tells you the altered metabolizer status, so that the doctors are going to be amazed to find out that only 60% of their patients really metabolize medication on a normal level. But then, most importantly, that's your opportunity to sell you, okay? Because when I came into this industry, I realized the bulk of these people don't know what the heck they're talking about. They're just getting people to sign up and do a study. Natural Molecular had a big bogus study. The OIG shut them down and they're out of business. Okay, Iverson had a study that never came around, and it's like the reps out there weren't educated on this, haven't learned it, and the way I want everyone here to sell this is on the technology, because this isn't a big revenue generator for the doctor. It's great for the patient, so it's going to be good for the doctor, and if it's good for them, then it's going to be good for us because they're going to use it. And I don't want to sell it on a study. Because if you sell on a study, you know what, your study's gone, you gotta go come up with another study, your business is gone. If I can have you guys go out there and say, look, you're doing a total knee or total hip next week, let's do this, okay, because we're gonna identify your high-risk patients, you're gonna put the patient on Coumadin, you know, here's data that,
That's huge.
yeah.
That's huge. That's such a big thing. You
That's a
guys,
game changer.
the second time I've been here, and that just hit the nail on the head.
Would that be a
really.
necessary